Type 2 Diabetes and Chronic Kidney Disease by
Daniela Lopez,
Haiti Lopez,
Ana Ramirez, and
Jacqueline Rosa.
good morning, classmates. As most of us are aware, by living an unhealthy, sedentary lifestyle, individuals become more at risk of developing various diseases. One such disease can be diabetes. There are two forms of diabetes, type 1 and type 2. Type 1 diabetes affects primarily the immune system, specifically the pancreas. With this disease, the pancreas produces little to no insulin, a hormone needed to allow sugar to enter cells and produce energy. Type 1 diabetes is usually the result of our genetic factors. On the other hand, type 2 diabetes is a result of poor diet and lack of exercise. In type 2 diabetes, cells do not use insulin well, which results in our body needing more insulin to help glucose enter the cells. Type 2 diabetes is also known as adult onset or non-insulin dependent diabetes, a chronic condition that affects the way our body metabolizes sugar glucose, which is the body's important source of fuel. According to the Center for Disease Control and Prevention, 1 out of every 3rd person will develop the disease in their lifetime. If left untreated, type 2 diabetes can develop in a more serious, permanent disease that can destroy the kidney. The disease is known as chronic kidney disease or chronic renal disease, a condition that is characterized by gradual loss of kidney function. Chronic kidney disease cases are more prevalent in the following racial and ethnic groups: African Americans, Hispanic, Pacific Islanders, American Indians, and the elderly.
With this being said, our testable statement is as follows. African American males with type 2 diabetes are more at risk of developing and being diagnosed with chronic kidney disease. The relationship expected between our outcome and exposure are that African American males with type 2 diabetes between the ages of 18 and 30 years old are more likely to develop chronic kidney disease at some point in their lifetime. The study design we'll be using that's most appropriate for our hypothesis is prospective cohort study. Participants will be followed from the moment they have been diagnosed with type 2 diabetes until the onset of chronic kidney disease. Our study will last for about 12 years because not everyone who has type 2 diabetes will develop chronic kidney disease immediately. In order to limit the losses to follow-up, we provided participants with incentives along the way.
the population from which subjects were selected were African American men who have been pre-diagnosed with type 2 diabetes and live in the Los Angeles County. Participants will be from ages 18 to 30 years of age and in the Los Angeles County. The reason we chose Los Angeles County because compared to other counties, it had the highest prevalence rate. Those who do not fall in this criteria are ineligible to participate. In order to prevent loss to follow-up, participants will be given gift cards such as Ralph's, Whole Foods, and Trader Joe's, and also free health care services at every 6-month checkup. The criteria for exposure are as follows: African American male with type 2 diabetes that are between the ages of 18 and 30 that live in the Los Angeles County. Those who fall in the unexposed group are African American males that are between the ages of 18 to 30 that live in the Los Angeles County that do not have type 2 diabetes. We will gather information on exposure through medical records and self-reported family history. We will be collecting our information on exposure this way because this way we can accurately determine if they have type 2 diabetes. Additionally, it will decrease the amount of differential bias in our study.
We will define our outcome as those diagnosed with chronic kidney disease by the end of our 12-year study. Those without the outcome are those who stay at risk rather than developing chronic kidney disease. We will get our information through medical records, our 6-month checkups over the 12 years of the study, and self-reported family history. We will be collecting our information on outcome this way because we can accurately determine if CKD has developed over time. Additionally, this way it will decrease the amount of differential bias in our study. Through medical records, we know that CKD is present within the individual. If a participant were to pass away during the study, a copy of autopsy report and death certificate will be requested to determine if CKD was the cause of death. In conclusion, it has to be recognized that type 2 diabetes is a major contributor to chronic kidney disease. By spreading awareness about the factors that contribute to this long-lasting disease, we are encouraging the public to adapt healthier behaviors to improve their quality of life.
Thank you for watching.
created using Powtoon.